bioidentical hormones are actually very good for you. At least that seems to be the conclusion of most studies. Most long-term studies have not been done in this country, again, because drug companies cannot make a lot of money off of bioidentical hormones because they are not patentable. But they have been doing this in Europe much longer than they have in the U.S. And so in Europe, there are long-term 20, 30-year studies in women showing a decrease in the risk of the diseases of aging, like cancer and Alzheimer's and bone problems, osteoporosis, for example. So a lot of women, as they get older, they lose bone strength and can have fractures, and there's all these new drugs on the market for that. But if you just replace the proper hormones that your body needs and get enough vitamin D and some calcium, then you wouldn't even need those medicines.
So why has it taken, I mean, you're the first person to come on my show and talk about this, although I know people like Suzanne Summers, you know, they've been talking about these things for a while, and Oprah. But even as recently as just a couple of weeks ago, I was accidentally listening to the radio, and a very famous medical doctor on the radio was just railing against hormone replacement therapy like he hadn't got the memo. And I'm thinking, how many doctors are not getting this and thus really not doing right by their patients?
Well, you know, women and men are suffering from the lack of the proper information on this, and there are major hormone conferences and places that doctors can go to get this kind of education, but it's just not the standard that most doctors are familiar with. Even my own OBGYN was refusing to give me bioidentical hormones.
Why?
You know, there's just a misunderstanding about it. Doctors are trained that the prescription hormones they're FDA approved, so they think that those are the only way to go. But they have so many more side effects, and they're so much more dangerous than the bioidentical ones, which do have to often be compounded. So they're compounded into creams, for example. So it's not only important that the hormone be bioidentical in its chemical structure, but also the method that you take that hormone is important. If you take a hormone by mouth as a pill, many times it actually has toxic effects. But the same hormone, like estradiol, if it's given as a cream that you rub on your skin, completely okay and good for you. So, and then there's how you take it, whether you take it every single day or whether you cycle on and off in a month to try to induce a period, for example. So there's many factors involved in how to take these hormones safely.
So what did you do then to go, I mean, first of all, interesting that your OBGYN wouldn't prescribe and you probably knew exactly what you needed. But so what have you done now with your practice that you're able to sort of get women on the right track? Are you able to prescribe the bioidenticals and so they will come to you?
It's actually a simple blood test will tell you whether or not your hormone levels are low. So it's a test that most doctors don't even bother to do because they just assume it's, again, natural to have low hormones as you age.
Yes.
So they assume that that's just natural to go through that and that's not worth replacing. But we know that our bodies need these hormones in order to function optimally.
Right, and if we're going to live to be 80, how nice it would be to do so comfortably.
Exactly. I always say that, you know, aging is inevitable.
Right.
But disease and disability are not.